All right, hello everyone. This is Asaf Glosser at MEF Associates. I'm pleased to welcome you to TANF Responses to COVID-19, Voices from the Field. Thank you all for joining us at this inaugural session of the 2020 NAWRS Virtual Workshop Series. NAWRS, the National Association for Welfare Research and Statistics, holds in-person conferences every other year where human services researchers, practitioners, and policymakers come together to talk about their work and how it can inform policy and practice. Several years ago, NAWRS began holding virtual events in years when the conference wasn't occurring. These events represent an important opportunity to keep the NAWRS community engaged and to highlight interesting research and trends relevant to our membership. This year's virtual series occurs as our country faces unprecedented challenges associated with COVID-19. The pandemic is affecting us all, personally and professionally. Many are worried about the health of loved ones, job stability, and the challenges that the pandemic and stay-at-home orders pose for us. For those that rely on safety net programs, this time is especially precarious. Whether it's families who've been receiving some form of public benefits for years, or those who are applying for TANF for the first time, human services programs can be a critical safety net for our communities. And just as these services are needed most, the jobs of the folks working in human services agencies have become the hardest. This may mean managing the transition to remote work, understanding changing rules around benefits and eligibility, or balancing their own personal and professional lives. Today, we're fortunate to have senior leaders from 4 state TANF programs to discuss how they're taking on the challenges of providing services during the pandemic. They're a mix of large and small states, state and county administered programs, and they come from all across the country. Instead of formal presentations, today's webinar will be a discussion. While I'll be posing a series of questions to our panelists, we're aiming for a relatively free-flowing conversation focused on the issues that matter most in state TANF programs. We'll make sure to preserve plenty of time at the end for questions as well. You can submit questions through the webinar interface and even upvote ones that other attendees have posed. We'll try to get to as many as we can. You can also use the Q&A box if you encounter any technical difficulties. Also, we're recording the webinar and we'll circulate the link to attendees following the event. Before I introduce the panel, I do want to plug a few additional upcoming events in the virtual series. Our second panel, focused on domestic violence during the pandemic, will occur next Monday, May 4th at 2 Eastern. This will be an opportunity to hear from human service leaders, federal staff, and domestic violence advocates about what the pandemic means for families experiencing or at risk of experiencing domestic violence. More details are available at the NAWRS website. That's nawrs.org. We'll also soon be announcing additional events in the series taking place later in the summer. These will be panels on issues such as machine learning, the Family First Prevention Services Act, and cross-system collaboration to serve justice-involved clients. Keep an eye out on the NAWRS Twitter feed and our website for more information. Now I'd like to introduce you to our panelists. Today we're joined by Erin Olikem from Vermont's TANF program, Babs Roberts from Washington State, Avis Hunter from Alabama, Catherine Smith, who's joining us from Colorado. Before turning things over to the panel, there are a few quick thank yous I want to extend. Today's panel would not have been possible without Mary Roberto at Manhattan Strategies and Jordan Engel here at MEF Associates. Both were instrumental in making this event come together. I also want to thank my co-chair on the virtual workshop, Lauren Antello at ACF. And finally, a particular thank you to the 4 panelists. They have incredibly busy jobs right now, and we really appreciate their willingness to share their thoughts and experiences with us. So to start things off, we're going to talk a little bit about some of the broad changes in caseload that our panelists have observed in their programs over the last few weeks. Babs, do you want to kick us off?
Absolutely. So thank you so much for inviting us to be a part of the panel, and I'm really excited to be here. I think as every state has probably seen incremental, or in I think most cases, the turning of a spigot and increased caseloads for all of our programs, whether it's food or cash assistance. I know that we've just started to dig into those application rates by demographic to see if we can determine where the bulk of them are coming from. And I think like most of you are probably seeing the bulk of these applications coming from urban areas, and certainly in Washington, King County was the first area, the Seattle area was the first area hit pretty hard by the COVID crisis. So I think those are some of the things we're seeing. We are also seeing sort of in addition to the doubling and the tripling, now almost 2 months into this, starting to see it level off a bit. So as other supports have become available, so UI benefits, stimulus checks, and people have other resources locally, or businesses have found a way to stay and keep their employees being paid, I think we'll see more of that leveling off as well. So I think I would start there. The demographic, actually I'll say, the demographic data is really important to us in Washington because we want to see if we can determine whether there is a disproportionate impact amongst populations, either based on race, ethnicity, disability, or potentially even geographically in our state. And then the last thing maybe I would say is that interesting to us is not only did we see an increase in demand, but we've actually seen a much higher approval rate on those applications than we would typically see. So going from around a 70% approval rate for most applications up over 82 or 83%. I'll stop there.
Hi, this is Avis. I'd like to share what's happening in Alabama. Interestingly enough, in Alabama, right now we have not seen the increase in the TANF applications that we kind of anticipated. There's been the surge in SNAP applications, of course, because clients, you know, depending on the food assistance. But I had some quick numbers run, and we have actually seen a slight decrease in our TANF applications over the last month. I do expect our May numbers to increase. But one thing that I have noticed is that Alabama doesn't have a client-facing portal. We're old school, we're on the mainframe, but we do have a mobile app called One Alabama that we have been gradually rolling out since September of last year. And it's a mechanism for clients to begin the application process for TANF. They can report changes to their TANF and their jobs case managers using One Alabama, and they can submit documents using that tool as well. So prior to the pandemic, we were seeing maybe 5 or 6 applications per week coming in through One Alabama. But now that we've gotten all 67 counties online, and since this pandemic has taken over, we've seen as many as 10 applications per day coming in, which is huge for us. Our caseload is fairly small here in Alabama. We've got about 7,000 TANF clients. But seeing that many applications come in through the One Alabama mobile app, that's about 15% of our TANF applications coming in via the app. And so that's something that we are pleased to see, because that means that the clients are utilizing the app the way we want them to. I think one reason that we haven't seen the increase in TANF applications is because our benefit level is so small here, is so low in Alabama. And I think a lot of clients, of course, as I said, applied for the food assistance benefits and are, of course, depending on the unemployment insurance benefits as well. So that's what's happening right now. That's the broad change that we've noticed here in Alabama.
Hi, everyone.
Hi, this is Erin. Oh. Go ahead.
Hi, everyone. This is Kathy Smith, Catherine Smith, obviously on your screen, from Colorado. And I agree with, Babs. What we're seeing here in Colorado is a fairly significant increase in applications, about a 60% increase in applications across the state. We have seen those decrease as well, starting kind of late last week into early this week. we still are seeing them higher than they would normally be, but they're starting to decrease from that 60% that we were seeing initially. And we also believe that that is attributed to the unemployment benefits and stimulus payments and things coming. And we have not actually seen, the increase in approvals. We actually haven't seen that at all, and we have not seen an increase yet to our caseloads per se, but I feel like it's a little soon to be able to tell that we'll be able to see that in our caseloads because our eligibility sites are still processing some of those applications that have come in over the last few weeks. But we are working on digging into the data, really making sure that we're looking at not only where in our state we're seeing the increases and application numbers, but also looking to see, you know, how quickly we're getting those benefits to our applicants to make sure that we're getting people what they need as quickly as we can.
Hi everyone, this is Erin from Vermont, and we are also seeing, or we did see an uptick in applications. So the first 2 weeks of our governor's stay-at-home order, which was the last week of March and the first week of April, we saw 4 to 5 times the number of applications that we typically get in a week. And then it started to go down again, actually pretty dramatically. And this last week was even the average, or the number of applications was lower than our pre-COVID average per week. So I'm not sure if that was just a fluke or if that trend is going to continue. I do think a lot of people are now getting connected to the unemployment benefits. And so we suspect that probably TANF, or Reach Up as it's called in Vermont, was the first stop for a lot of families because they knew that the benefits would be get to them fairly quickly. And what we saw was in those first couple of weeks, a huge increase in the number of people that had not been known to our system previously, or who had not been receiving Reach Up for quite a number of years, but came back for this amount of time during this time period. So that's pretty much what we've seen in Vermont.
Yeah, it sounds like a lot of variation across the states. And, you know, I think one of the things, Avis, you mentioned is a variation in application rates by benefits program. So it sounded like in Alabama, there was a more substantial increase in SNAP compared to TANF. I'm curious among the other panelists if you saw that difference as well, or if it felt like those trends you were talking about on the TANF caseload were similar for the other programs either your partner agencies administer or that you may oversee.
This is Kathy in Colorado.
Sorry, Kathy, go ahead.
No, you're fine. In Colorado, we have seen about the same increase percentage-wise in our SNAP applications. We do have some additional cash programs for our elderly and disabled populations here that we haven't seen quite that significant of an increase. We've actually seen about a 10% increase in those applications in comparison to our SNAP and our TANF caseload.
Yeah, in Washington, we actually saw a 300% increase in the SNAP applications and 150% increase in the TANF caseload, and then something smaller, 75% or so, in our age-blind disabled cash assistance program. We also implemented a state-funded disaster cash assistance program in the middle of April that does require us to screen for other cash programs before we issue the disaster cash, and so that did increase our application rates in those programs as well. But we began implementation. Our governor went into shelter in place in the middle of March 16th, I think, 15th actually was the shelter in place order. So And our UI system is really bogged down right now. So I think we are seeing higher application rates because of that.
And Babs, one follow-up question for you from one of the attendees was, you had mentioned earlier that increase in the approval rate. You had mentioned sort of that 82, 83%. Was that specifically for TANF, or was that for TANF and SNAP?
It was across the system. It was across program areas. We saw significant increases in approvals.
And then another question for all the panelists that just came through is whether there's been any effort in any of the states to reach out to SNAP applicants who look like they might be eligible for TANF. So it sort of, in essence, proactive outreach to potential clients.
This is Erin in Vermont. We've done some outreach through Front Porch Forum, which is kind of a message board for neighborhoods. And I believe there was some press releases that went out. We've also seen similar application increases for the SNAP program, even a little bit higher in the second week, up to 6 times the number that we had seen previous to this epidemic. And so we're also doing the payment just went out for through the emergency payment for SNAP benefits that increased the benefit to the maximum amount. So everyone who's already receiving SNAP gets the maximum amount that they could get, and there are going to be 2 more payments that will go up for that. So a lot going on in that world.
I think in Washington, Avis, go ahead.
Hey, Bab. Okay. I was just going to say in Alabama, we have not done any outreach to our SNAP clients to look at their potential eligibility for TANF. We have not gotten to that point yet. That is something that we'll probably be, looking into in the upcoming weeks. So depending on the increase in the SNAP applications has been just huge. It's been overwhelming, and but we haven't thought about outreach at this point for TANF purposes.
In Washington, I think one of the things in terms of the SNAP applications that was really beneficial is even before the shelter-in-place order, as our incident command structure stood up, one of the primary issues that they focused on was how do we get people connected to food should they have to shelter in place. And so the governor's COVID-19 response website and a number of the food banks were promoting the idea that SNAP might be available to folks who are seeing reduced hours or losing their jobs. So while we didn't do any typically traditional outreach efforts around SNAP, we did have others doing it for us.
This is Kathy in Colorado, and similar, our outreach partners have, although a lot of their focus has been on SNAP, they have also been ensuring that they have materials and information related to our TANF program, which is the Colorado Works program here in Colorado, in case people hear me using that interchangeably. And then in addition, just so everyone's aware for context, Colorado is a state-run, county-administered program. So our county is kind of dependent on their own resources and abilities and plans. Some counties have been doing outreach maybe more than others, so it really kind of depends on the county that is running the program as well.
That's really helpful. I think that sort of a subtext to a lot of the discussion so far, as well as the questions that are coming in through the Q&A, are sort of policy related. And so I'm curious, just as a starting point, and then we'll get to some of the ones in the Q&A, is what policy changes, if any, have you made in response to the pandemic? And I don't know, Kathy, if you want to go first.
Sure, definitely. So like I said just briefly a second ago, we're a state supervised, county administered state here in Colorado. So there are some flexibilities with our programs within the counties that I'll kind of discuss too. But our current state rules and our work verification plan were written with enough flexibility that it was not a challenge for us to work in the current situation to provide flexibility to counties and our clients. So county eligibility sites have been encouraged, of course, to provide all services remotely as much as possible. The rules in Colorado had already allowed for telephonic interviews for eligibility, and so we have really just more broadly enacted and encouraged that to avoid face-to-face contact. In addition, Colorado's Program Eligibility Application Kit, which we call PEAK, allows for clients to submit applications, recertifications, verifications electronically. So that's something else we've really been pushing and communicating highly to not only our eligibility sites, but to our clients to avoid them needing to go into the office. Of course, our counties have all kind of decided in their own way if they're going to stay open or how they're going to provide services, but that's been our direction as a state. We have continued to require interviews be completed for initial applications because we really want to make sure that we have the time necessary to fully explain our program requirements, discuss domestic violence concerns and resources, and assess for other needed resources. And I touch on that because here in Colorado, we did receive a waiver for our SNAP benefits to waive that interview requirement. But for our TANF Colorado Works program, we made that decision to continue for initial applications, that interview requirement. It also does provide us, of course, with the ability to determine if the family would benefit more from an ongoing basic cash assistance grant, or if a diversion payment would be a better fit for their needs by doing that interview. For our recertifications, we did automatically extend those in our system for 6 months, and we're doing this through the end of June. So any recertifications that were due April, May, June, those would be automatically recertified for 6 months. Clients are still expected to report changes through this. So of course, if something changes in their household that would make them ineligible, we are still expecting that changes be reported and that they be acted on by the counties. Any certifications were extended because we wanted to reduce any breaks in our benefits for clients, reduce the need for them to submit paperwork during this time, because we know that not everyone has access to do that electronically or even by mail. Some may not feel comfortable doing that at this point in time. For verifications, our rules were already fairly flexible in the ability to obtain collateral contact and very minimal verifications, but we are really encouraging the county eligibility sites to utilize collateral contact in any way possible. And then if someone's unable to provide verification due to COVID-19, we can allow good cause for them in order to avoid any break or delay in their benefits. For our work requirements, we are giving good cause in any situation where participants are unable to meet the work requirements because of the COVID-19 situation. Our workforce sites are continuing to provide virtual assistance to participants during this time, make sure that they're still assisting in all areas of workforce development, whether that be job search, training, those things for whatever is available at this point. They are also still, of course, doing supportive services and issuing those to individuals during this time. And workforce is being done virtually and assessments are being done virtually, just like our eligibility requirements are. Contract-wise, we have had to amend some contract requirements, both at the state level and at the county level during this time, just to provide some more language around virtual service delivery. Some counties have also entered into some new contracts with community providers or expanded funding for their existing contracts in order to better serve clients because the needs are just greater at this time. There are a few other areas where we've done some flexibility in our current rules during this. Tax interceptions for claims have been halted for this tax year, so we won't be intercepting taxes that were issued from March forward. Telephonic signature recording, part of our rule was to require that if the signature for an application was received telephonically, that needed to be recorded and held. We are waiving that requirement for this period of time and allowing that to be documented through case notes. We did decide to the additional UIB CARES payments for the federal pandemic unemployment compensation, the FPUC category. We are excluding those from our income requirements as well. One of the most important ways, of course, that we're able to assist our families policy-wise during this time is through counties enacting their disaster assistance plans and utilizing broad categorical eligibility during this time for families. This is giving them the ability to provide a broader population with supportive services, diversion payments for assistance with things like rent, utilities, any of those daily needs, transportation, things that they may be challenged with because of what's going on right now. So that's been one of our biggest ways to assist. Counties are able to kind of set those limitations themselves within their own disaster plan, and then issue and utilize those payments based on their own plans. Communication-wise, we as a state, of course, communicate all of these requirements with our county eligibility sites via our operational memos, guidance documents. We're having regular county stakeholder calls to update regularly on the things that we're looking at changing, all of those things, getting feedback. Program participants themselves are notified of the changes and requirements through their eligibility sites at the county level. Some of our program changes have included noticing, so when we're moving out recertifications and things, of course, they're receiving that notification of their benefits via either mail or telephonic notice, electronic noticing, whichever they have selected. So that's been our communication plan, and then our website is also up to date regularly on all of those pieces. So I think that is kind of, in a long nutshell, everything that we've done here in Colorado, and I'm sure there are probably things that I'm forgetting that others will mention that I can chime in on also.
Thanks, Kathy. I want to sort of follow up on a couple things you mentioned that have also popped up in the Q&A that I'm curious to hear other panelists talk about as well. One of which was you talked about sort of waivers for work requirements. And so if other panelists sort of, if you aren't doing that, sort of keying in on that, and also just the extent to which was someone asking whether folks are aware of those policy changes, sort of folks who are already on your caseload. The other thing that's popped up in the questions a couple times is how you're handling some of the new other cash infusions that folks might be experiencing, and that includes UI benefits or the stimulus checks, and what that might mean for eligibility and how they're interacting either with TANF or some of the other public benefits programs in your states. So I don't know if any of the other panelists have thoughts on that front.
So this is Babs in Washington, and certainly I think we did quite a lot of the same things that Colorado did, the certification waivers for 6 months. We did also get an interview waiver for SNAP and chose not to do that as well. I think in terms of TANF though, we are state administered, so it's a little easier for us. We did a blanket exception, so work participation for TANF is assumed to be good cause unless the person wants to continue their activity and can continue their activity. So we've done a statewide blanket waiver on TANF participation rates. We've also done a blanket exception to the time limit. So Washington still has a 60-month time limit. We've done a blanket exception to the time limit. I think that might be part of the reason that our caseload went, or our application rates went up. Is that people did hear about that. We have a broad stakeholder and advocacy groups that will ensure that people hear about that, and we did press releases around it. We've also given broad flexibility around sanction policies because participation at this point is very difficult on a statewide basis. So in terms of TANF, we've really broadened our policies around that, trying not to do sanctions, exempting people from participation. And we did that, the exemption to participation based almost entirely on the fact that by definition, a TANF family has a child in the home and schools were closed statewide. And that makes participation very difficult for families. Some of the other things that we did as well is to eliminate the need for home visiting for teen parents and sanctioned home visits as well. So both for a safety factor for the client as well as our staff. And we've also done a few things around, as Colorado mentioned, around easing verification requirements, using collateral information like the governor shutting down dining establishments, recreational facilities, et cetera, and being able to know in our interfaces that that's the kind of job that person have. We don't need necessarily a stop work form to verify that information. I think in terms of other things, one of the other things that we did around extending the time limit was in relation to medical evidence. A lot of the reasoning behind giving somebody an extension or an exemption to participation is related to disability or physical or mental disability, domestic violence, and it's very difficult in the current situation to obtain that evidence. Doctors are not seeing patients and they're not filling out extra forms and those kinds of things. So those are some of the big ones that we did around TANF, and is probably one of the reasons that our application rates went up.
This is Erin from Vermont, and we also have done a lot of this similar things to Washington and Colorado. We also have waived our work requirement, and we've halted all sanctions that were due to start and asked case managers not to start any new sanctions. And we also ended any sanctions that were in place at the time of this, just to get families as much income as possible. In Vermont, we have time limits, but they're perhaps a little bit different. So what happens is when somebody reaches their 60 months, under normal circumstances, they can continue to receive reach up as long as they're participating in the program requirements. If they don't participate, then it's the case closes. And so essentially it's just replacing sanction with a closure. But during this time period, we ended all closures for that reason. And interestingly, we're finding, so we also halted home visiting. Our case managers did home visiting, and our offices remain open, but we are not requiring people to come into the office. And so pretty much, I would say probably 99% of the meetings that case managers are having with their participants are either on the phone or Skype or FaceTime. And it was interesting to talk to some case managers the other day who were saying that they're finding that parents are actually in a lot of ways more engaged because they're appreciating the fact that they can pick up the phone and talk to someone and not have to, bundle up kids. And we're still bundling up kids in Vermont here because it's still cold, and get them to a location and just appreciating kind of the support of having another adult to talk to during the day, and someone to kind of help troubleshoot how do we get basic needs met and things like that. So those things are happening with case management. And then in terms of eligibility requirements, we have waived interviews. However, we are going to start doing interviews again at the beginning of May, so on Friday. We also did bump out all of our reviews for 6 months for March, April, and May review dates or recertifications. And we've simplified a lot of reporting and verification requirements to allow self-declaration in many cases. Let's see, the other thing that we've also for eligibility is that we're considering all pregnancies high risk. And so in Vermont, that means that we can give TANF benefits to someone who is within 90 days of their due date. And we've also stopped the clock. So, so we're not counting any of those months towards the 60-month time limit.
Okay, so this is Avis in Alabama. We've done some things similar to what have been done in Washington and Colorado and Vermont as well. We did go to the telephone application interview as well as the recertification interviews. We were already doing telephonic application interviews for our child-only cases, but now we, as of the middle of March, we are doing those for all applications and all redeterminations. Applicant job search is something that was state mandated back about 6 or 7 years ago, so currently we are waiving applicant job search for applications. If the client doesn't already have an exemption for that, they're not required to complete applicant job search for eligibility purposes. And one large thing that we did also, a biggie for us, was we also went to client declaration for all points of eligibility. And what we instructed the caseworkers to do is, if the case is otherwise eligible, award the case and postpone that verification for 90 days. So they're setting worker alerts on these applications that they're awarding with client declaration, and they'll reach out to the client in 90 days to see where things are and if they can get the verification that they need at that point in time. Also, regarding job sanctions and penalties, as of April 1st, we suspended all penalties for noncompliance and restored benefits to clients that were currently being sanctioned for noncompliance. And we also ended disqualifications, and we reopened the cases that had closed effective March 31st due to jobs disqualification. So we reinstated those cases and restored benefits to those as well. And we sent out client notifications via mail to let clients know what was going on in that regard. For jobs and work participation, all work participation activities are also suspended, basically. We've got good cause for participating in any assigned jobs activities, including assessments or reassessments. We are not referring clients to provider agencies such as the Career Center, of course, or VRS, unless that contact can be made by phone or can be made virtually. So those are some of the things that we've done from an eligibility perspective. And basically what we tried to do was change our policy, streamline it as much as we could to make things easier for the clients to become eligible for assistance and to prevent that face-to-face contact, to minimize face-to-face contact for the client and for our staff. And those are some of the things that we've done at this point.
Thanks. And that's a nice segue into the next question I wanted to pose to the panel about sort of delivering services in the face of stay-at-home orders. And folks already started talking a little bit about ways to minimize in-person client interaction and utilizing whether it's telephone or apps to communicate. But I'm curious to hear more on this front. And Avis, do you want to talk a little bit more about service delivery in this new environment?
Sure, I'll continue. So in Alabama, we are state administered. We've got 67 county offices that are operating, and none of our 67 county offices have closed. The only time they closed was if, of course, a staff member tested positive for COVID-19 and the office had to be closed for, sanitizing and things like that. But our county offices do remain open with very little clients coming in for services, though. So what we were able to do, our commissioner, the first thing she did was for our SNAP workers, because of the huge increase in the SNAP caseload, she was able to get Chromebooks for our SNAP caseworkers so that they could go home and work remotely and handle that large SNAP caseload. Last week, we were able to get Chromebooks for our TANF workers as well, our eligibility workers. So with sending them home to work remotely, we had to issue guidelines for telework. As I said, we streamlined some policies. And most importantly, the county offices had to develop procedures to provide in-office support for those staff that were working from home. Things such as mailing affirmation statements to the client that we still have to have signed before we can award a case. Scanning and emailing the actual application packets to staff that are working from home. So each county, it probably looks different from county to county, how they're handling that in-office work. and the county had to work that out before they could allow their staff to go home to telework. We had to be mindful of things such as we did not issue workers phones, so we instructed them to use *67 when calling clients to protect their personal information, names and phone numbers. Those are some of the things that we have done about, client contact. The other thing that was big for us is that not wanting to lose momentum with some of our clients that have been successfully participating, whether that be successfully placed in employment or even enrolled in a school or education program, but still recognizing that this is a stressful time for families. Some of our providers did want to maintain phone contact with the clients, and we make sure that when those providers do reach out to our clients, if the clients don't respond, we make sure that there are no adverse actions or sanctions that result from the clients failing to respond. At the same time, we have been encouraging our clients, we've been reaching out to our clients, the jobs case managers have, that is, to contact us as needed to talk about whatever they might need to talk about, whether it's, homeschooling or whatever concerns they might be having as it relates to dealing with their families and having to be kind of quarantined in the house. Another thing that we had to think about when we instituted teleworking was confidentiality. With schools being out and clients and workers being at home with spouses and at home with children, we had to stress that the rules for confidentiality were still in place, of course. And so we wanted our staff to be mindful that they need to try to set up a workspace somewhere in their house where they, wouldn't be interrupted, where conversations with clients, of course, couldn't be overheard and things like that. And on that topic, I would like to mention this. We did have one worker from one small county that really did not want to work from home. She said that her children were at home. She felt like it would be too stressful to her to try to manage the kids in the house, plus trying to focus on her job duties. She works in one of our smaller county offices. She has a private office, and they're not a cubicle. So she really, for her, telework was not a benefit. It wasn't a good fit for her. Instead, she preferred to continue to come into the office, knowing that we have, put procedures in place to limit clients coming to the office. She just felt more comfortable working like that. So to me, that just kind of was a reminder that, there's not one size that fits all when we're trying to support our staff. Different things work for different staff, and yes, most of them were welcoming to be able to work from home. There were a few that had concerns that would prefer to go into the office and work, and of course we supported them in their desire to do that.
So maybe I'll jump in. This is Babs, and I can say that we have 95% of our staff are teleworking. We had a good platform to step off of in which to do that because we already had a statewide virtual contact center and a great call center platform. For us, it was a matter of getting the rest of the sort of in-person staff licensed in their systems, their computers home, and access to internet. So once we were able to do that, we were able to put most of our staff on the phones. We gave very few exceptions to the telework mandate because it was a mandate. While they are essential workers, it was a mandate from the governor. We have 2 to 4 staff in each of our CSOs, our community service offices, that are doing emergency issuance of EBT cards for populations that don't potentially have an address we can mail them to. But other than that, and some emergency supportive services like gas vouchers, et cetera, for some of our clients. Other than that, we're not seeing clients in person. So the bulk of our staff are doing their work telephonically. Because we do have the robust call center platform, we have implemented telephonic signatures in Washington State. So the need for mailing information back and forth or getting documentation to us is really reduced because we have great interfaces and we have the telephonic signature option in our call center. And we have a statewide portal that not only allows for application and recertification, but to some extent allows for the client to self-serve in some ways. And we have a fax line for sending documentation directly into our imaging unit. The only staff that we have other than the the couple of staff in each office doing EBT that cannot telework are those that have to do the actual imaging of documents that are mailed or faxed in. And where we set up social distancing for them in which to do that. We did have some staff who really resisted going out on telework for some of the same reasons that Avis talked about, feeling like they wouldn't be able to adequately focus on their work with all of the hubbub around their household. But if those staff that were resistant to that were also in what is considered a high-risk category for significant negative impacts should they get COVID, we really didn't give them options. The governor issued a shelter in place, and he issued that in conjunction with a mandate that we have people telework where we could have people telework. And so we gave very few exceptions. And I would say notably for me, and something that was profoundly impactful to me, is that one of the exceptions we did end up giving to a staff person was because they actually were homeless themselves and didn't have an adequate space to set up a computer and do their work. And that was profoundly impactful to me, that one, that they felt comfortable to disclose it to us and so we could actually provide some assistance to them, but to know that we have staff who are in government jobs who are still not able to meet their needs was I can't even describe. But it's been, I would say this has been a really incredible learning experience in terms of case management, doing this telephonically and having the ability to have that access to doing our comprehensive evaluation and our individual responsibility plan development telephonically is actually going to be great for us. Before this crisis started, we had been pushing through piloting, setting up pilots around how would we provide a broader sense of access to populations that find it difficult to come in and see us. And this is giving us really a chance to test some of the ideas that we had come up with around telephonic or virtual access, setting up things like video conferences and telephone conferences to provide people with services was really, it's really exciting because it's really going to help us when we move out. But it's also going to help us in that sort of culture shift with social service specialists, social workers, and case managers who have traditionally said, I can't do my work virtually because I need to see people face to face. We need to have discussions, and you can't do that virtually, are now finding that they absolutely can do that, and they can do it effectively. And that's really going to be another big piece for us. I think the biggest issue that we're facing right now, and I don't actually have a resolution to this, but is supporting staff right now, understanding that they are trying to do really difficult jobs while they're also stressed with schools being closed, potentially spouses or family members who are experiencing job loss because of this crisis, or potentially caring for loved ones in their home that are high risk or are actually sick, has been one of the things that we've really struggled with. And things we've put in place around this is sort of daily or weekly newsletters or emails around self-care, reminding folks to take a breath. One of the biggest things we did is we suspended for our staff performance metrics. So not holding them to production targets, not holding them to sort of audit standards necessarily, but really just sort of relaxing some of that and saying, do the best you can versus continuing to monitor that performance in a way that we used to be able to monitor it. And the staff have responded well to that, but even so, we're seeing a lot of stress amongst our staff, and a part of that is isolation. They're used to interacting with each other, and that's been one of the things we're dealing with now. And I'd love to hear ideas that others have around that.
So this is Kathy in Colorado. Of course, we've done many of the same things that that both Avis and Bab discussed. Like I mentioned before, our county offices really have that decision whether they're going to remain open or closed. And up until just Sunday, of course, we had our stay-at-home order that most were following, in that the majority of individuals were working from home whether that be at our state office or county offices. But we did still have some county offices that remained open as an essential business, quote unquote, I guess. And so it's been different dependent on the county and if they're still having clients come in. Often we have some that still have employees going in, but the office itself is not actually open to clients. So it's kind of varying depending on where you're at in the state. For us, as the Department of Human Services, the direction that we've given, of course, is that we really highly encourage there to be as much limited contact as possible in following, governor's orders and social distancing. We are encouraging clients to apply online as much as they can, but we are ensuring that our county offices do still have, if they're closed, someone coming in to check the mail on a regular basis so that there is not a delay in benefits when things are received by mail. We're also ensuring that all of our county offices have applications available outside if they're closed, so that individuals who aren't able to access applications electronically can get a paper application still. We do require that they still have that ability to issue EBT cards so that they can access their benefits. Here in Colorado, we do have EBT cards still where our cash benefits are going to. We do have the option for direct deposit and key bank cards also. And so we're really encouraging counties to utilize those first and foremost before EBT. But if not, we have an option for mailing EBT, and then the county offices are still being required to ensure that they're able to issue cards there in person, even if they're not open for business per se. I agree. I know that Babs mentioned, this has started to help us think about how can we do this more effectively at home moving forward. And I think we've started to see that too. Many of the things we thought, no, gosh, this has to be an in-person or interactive type activity. We're finding that maybe some of those things in the future, we may be able to do this more virtually. And so I think that's one positive we can take from this, is kind of thinking about how can we be more innovative with our technology and meeting our clients where they're at, our employees where they're at, to meet everyone's needs moving forward past the pandemic situation. We're doing some of the same things self-care wise, understanding that our employees are facing some of the same things we all are right now, right? Where we're home with children, family members, other distractions, and we've got competing priorities. And not only that, this is just a stressful time for everyone. So really trying to work with not only continued contact, so we've been trying to have regular meetings, just touching base meetings, and even just for fun things. Each day we have kind of a funny email thread, and then we regularly each week have kind of a water cooler talk where it's not about work, it's just for us to chat and kind of catch up with each other, so we still feel like we have that connection. So that's been good. And then really encouraging our managers, supervisors to be understanding with our staff members. Sometimes we've just got to have a mental health day because of everything that's going on, or we need a day to really focus on being a parent. And so really making sure that we can, as much as possible, provide some of that leniency with people. With some of our staff who have kids at home, helping to make sure that they understand, hey, if you've got to take a couple hours to do schoolwork, whatever that may be this afternoon, they may end up kind of working later in the night. That may work better for them. And so we've been trying to be as flexible as we can be with staff through this when we've got some of those conflicting priorities that are going on right now.
Hi, this is Erin from Vermont. Also, many of the same things that all of you have been talking about. Most of our workforce is now remote, and many of our workers were not set up to work remotely, and so it was a huge scramble that our operations directors really worked really hard almost overnight, and within a couple of days got pretty much everyone working remotely and finding every laptop that we can in the state to make sure that people could do that. We do still, like other states, have folks working in the office to manage documents that are coming in, make sure mail gets out, things like that. And there are a few people in each district office that go in to make sure things get done there, and that if somebody does walk into the district office, that they will be, they'll get their needs met and they can be helped. We wanted to make sure that if there were folks who that was their only option was to actually come into an office because they don't have phone or internet, that they are still able to do that. So that's why our offices are still open, though I think very few people are coming in. And in terms of case management, really trying to continue to focus on the shift that we were making before this, which was to move towards a goal achievement model of case management. And so in a lot of ways, there have been a lot of opportunities here to figure that out over the phone with folks and be able to break down tasks and break down goals into achievable steps. And sometimes that's looked a little different than it may have before. So now some of what we're hearing staff are really working with families on are how am I going to get food this week? Because maybe somebody doesn't have transportation, they live in a rural area. Getting their laundry done, homeschooling their kids, self-care, trying to make sure that families are feeling supported, and getting access to internet. And also some of our case managers are actually literally delivering food. That's something that our division has taken on, is a food delivery, so that families who are isolated and can't get food in any other way are getting food delivered to them. In terms of supporting staff, also many of the same things, just connecting folks to resources, to EAP, making sure that they are connected to, there are several kind of mindfulness and meditation programs that are going on virtually, and connecting them to those types of things, and just checking in frequently and reassuring people that we know that they're doing the best that they can and under difficult circumstances, and we're all in the same boat, which I think has been kind of freeing, because in some respects, in terms of like working remotely, we all understand that if a toddler pops up in the background of a Zoom meeting, or a cat walks in front of the screen, that it's actually just kind of a welcome breath of fresh air in an otherwise kind of difficult situation. And so it's really about being more understanding and flexible, and realize, where our home life and our work life is now so intertwined, and how do we kind of redefine the work that we do and do it within this slightly different context for many of us has been challenging, but also I think a kind of an exciting opportunity, as a few others have mentioned.
And Aaron and others, you started alluding to this already in terms of the challenges that clients are facing, both with sort of benefits programs specifically and in their life more generally. And I'm sort of curious, Aaron, if there are other things you and then the other panelists can talk about in terms of specific needs that are arising from the pandemic that might be going unmet right now, either because your program doesn't have the resources or they're just so daunting.
So I think one of the things that I guess became even more highlighted, even though it was something that we have always addressed and have worked on, is transportation. And you realize it's always difficult to be stuck in a rural area without transportation, but when you literally can't get those your very most basic needs met, because you can't get to town to do your laundry or go to the grocery store or whatever it happens to be, that becomes even more profound. So we have a transportation provider that initially pretty much completely shut down, but we've been able to, they've been really great and have worked with us, and we've been able to kind of gradually get them working in getting people rides to things that they might need. So that's been helpful, but that's definitely been a challenge. And I would say some of the other challenges are folks who don't have phones or are running out of minutes on their phones, and just trying to get in touch with them and support them. And sometimes, of course, people don't have transportation and they don't have a phone. And so, you know, as a double whammy, like, how do you try to support these families when you can't even get in touch with them? And then internet, which in Vermont is spotty at the best of times. But now, you know, just trying to get families who might even not have been connected to the internet, trying to figure out a way to get them connected. And then that's kind of where, for us, our lack of nimbleness with our IT system comes in, because even though, like, we may have support services to be able to help people pay for internet, we don't have a great way to pay for that internet. So just trying to figure out some of those things has been certainly challenging.
So this is Babs, and I would just echo what Erin just said. Is I think the biggest challenge is access for clients, and that's access to us, definitely, in terms of phone minutes, so to call our call center. We do have an interactive interview process, so we don't necessarily need a paper application, but having sufficient minutes to give us a call on their phone is problematic for some folks. And then realizing that many of the places where free Wi-Fi is available, and that our clients were using the free Wi-Fi to get connected to our portals or even to do Wi-Fi calling, were also places that were shut down in the shelter in place. So local libraries or coffee shops that offer free Wi-Fi are not open, and their Wi-Fi is not closed. And we've, as that became really apparent to us early in the shelter in place, what we're seeing now is that many of those places are now going in and turning on their Wi-Fi in the morning, and allowing for people to sit in their parking lots and use the Wi-Fi systems. Certainly a lot of the local libraries have done that. Some of the community-based organizations that might have been helping clients do applications are doing things like that as well. So it's really, for me, been amazing to see the communities come together to find ways to create access for folks, and that are exhibiting those kinds of issues. I think maybe Washington, because of the interactive interviewing and the telephonic signature, had a good platform to step off of. It hasn't been as big an issue. Certainly we're picking up paper documents in our outside drop boxes as well. But I think the other key challenge that we have seen is even in our portals. While we might have some languages beyond English in our online portals and on our phone lines, we don't have all languages. And Washington is a very diverse state in a number of areas. And that population, the limited English proficiency population, they're struggling to navigate websites for information that aren't available necessarily in their language, and the local sort of community-based organizations that would have helped with that are also shuttered. So I think that is a population that is really struggling right now.
This is Kathy in Colorado, and we've seen similar. We've gotten quite a few concerns and reports from our clients who have English as a second language or may not even speak English at all, who have previously really relied heavily on interpretation services that right now are not available. We do have, luckily, a statewide language link line where there is some ability to translate there, but that would require in person or someone over the phone at a county or state office assisting with that. So that's been one thing I agree in Colorado we've seen as somewhat of a concern that's come up and has really prompted us to start to think about making sure that we can get our online tools to be in multiple languages rather than just in Spanish and English. In addition, all of the other areas that were discussed, transportation, of course, job search right now is a challenge, and assisting people virtually with that is a challenge, not only just because of the virtual piece, but because of the limited amount of new jobs or hiring that's occurring. So we're seeing our homeless population especially having some challenges with getting through to our county offices, either by phone or in person, to ask questions about their benefits and get their EBT cards. So we've been really just trying to work towards making sure that we can still provide those critical services, even if we're not in the offices. So how are we making sure that we're available to answer questions and get benefits issued, issue EBT cards, all of those things while offices are closed and we are practicing that social distancing piece of things. So we've been doing our best to do as much supportive services as we can, increase staffing on our statewide call center, as well as encouraging our counties to do the same so that our clientele can get through and ask those questions, get the answers that they need, get assistance walking through things. And our outreach partners have been really helpful as well in taking on some of that additional assistance to our clients in walking through what the application process even may look like, especially for our families and individuals who this is new for. They need some of that assistance walking through the process because they haven't been here before. So.
Okay, this is Avis. I will ditto the same things that my colleagues have spoken on in terms of access is a huge issue for our clients. It's a challenge for them. Access to transportation, of course, as was said. Access to the internet is something that we cannot provide assistance with. Some of the local school boards actually have done something that I thought was kind of neat. They used the school buses as Wi-Fi hubs, and they sent the school buses out to the different neighborhoods throughout the day so that the children can do their own school online learning, so that clients as needed can connect to services that they need. And I thought that was really pretty an innovative way to handle that. Another thing, when all this started back the end of March, access to basic things like cleaning supplies, like Clorox, like toilet paper, was a huge issue here in Alabama, and I'm sure it was nationwide. And one thing we decided to do was we issued all of our TANF families that were recipients what we called an emergency health preparedness allowance, a one-time non-recurring benefit. We gave each household $400 to kind of help them with in purchasing those things that we all needed for cleaning, hand sanitizers, things like that, so that they wouldn't have to be thinking, well, how can I squeeze out money for Clorox, for bleach, for things like this out of my TANF benefit that is not that large in Alabama to begin with. So that was one thing that we did to try to provide a little bit of assistance for our clients, to try to ease their minds on for trying to have to not worrying about getting those things. I think that really when we talk about challenges that our clients face, they face the same challenges that we do, homeschooling children. How difficult is that? All of us didn't go to school to be educators, and here we are trying to, deal with having to try to help our children thrive and prosper at home. Some of our clients were doing really well in educational training programs. I know of one client who was in her last semester before she finished nursing school, and to get her LPN, and then she had to switch to online, so we had to provide her with internet access. We had to provide her with, equipment and things like that. And so we were able to give her the supportive services that she needed so that she will be able to finish this quarter and graduate and get her LPN. So it's just things like that that we have to be mindful of in trying to support our clients, just day-to-day needs. And it is a challenge, and I think this is an opportunity, though, for us to, as you all have said, think about how we're doing things now and how can we do things differently in the future, and do we always have to do things the way we've always done them in the past, or is there a better way? And are we finding that better way now as we're challenged with some of these things as a result of the pandemic?
Which leads us right into our next question, and also some of the questions we've been seeing from folks in the audience. And so we heard a lot about changes programs are making in direct response to the pandemic, but I think equally important to think about the extent to which some of those changes might be viable longer term, and whether it's service delivery or whether it's policy or sort of rules or just the way you do business. And so I'm curious to hear, from each of the panelists where you see some opportunities for longer term change.
This is Erin from Vermont. I just love how you articulated that, Eva, and I completely agree. I think that this is a time that is it's so challenging and so stressful for everyone, but it's also a time that is so ripe with opportunity. And I feel like it's our job as leaders to really take hold of that opportunity and do what we can to move things forward. And I think we're discovering so many things that we didn't think were possible before. And within, in some cases, a day or two, we kind of turned things upside down and we realized, yeah, we actually could do this. It just took us a crisis to realize that in a situation where we had to do it, to realize that this actually could work, and maybe in a lot of ways we'll end up in a better place. And so one thing that I was thinking about is, and this in particular, this example is kind of outside of TANF, except that it's related, but I'm thinking of telemedicine and telecounseling. And will this help people get connected more easily to some of these things that they need? In particular with telecounseling, I think so many of the families that we work with have mental health challenges and a difficulty accessing those services. And so one of the programs that we were actually putting into place before this all started is called the Moms Partnership, which is a program out of Yale University. Mm-hmm. That we're replicating in Vermont, and it addresses maternal mental health in group cohorts with a peer mentor embedded in the program. And we were thinking we were going to have to put this on hold while this is happening. And instead, what we did, and our community partner who is working really spearheading or organizing this, the bulk of this, they started doing this through Zoom. And so something that we initially thought, well, we're just going to have to wait. And then everybody kind of said, no, wait, why do we need to wait? Let's just keep going and do this through Zoom. And the folks have been incredibly engaged, have been really thankful, maybe now more than ever, to have a way to connect virtually with other moms and kind of deal with these major stressors in their life. And so it's been really, really encouraging to see that happen. And then just being able to streamline so many rules and forms and things that we realize aren't needed. I think we have staff who are forgetting about some forms that they used to really like and now are and probably don't even remember that we used to have those forms. And so I think really just getting the chance to reboot and start over in a lot of ways and realize what are the very basics of what we need to help families move forward, and be able to start at that place and build from there is a really refreshing and exciting opportunity. It's something that really kind of keeps me going during this time.
This is
This is
Kathy.
Babs, and Aaron, oh, sorry.
Oh, no, Babs, go
Aaron,
ahead.
I just want to, Aaron, I just want to say that that's awesome. I mean, it's in exactly the right attitude that there is so much to be learned from this, and, you know, never let a good crisis go to waste, right? I would say the other thing that I see coming out of this particular crisis that it is powerful and could be really positive is a dawning recognition that the narrative around poverty needs to change, that at any given moment, something can happen and everybody goes into crisis mode, and that everybody needs a little bit of help. Just looking at how fast the UI claims had to go into place and how Congress had to act on that everybody is very close to the edge, or a lot more people than we think are very close to the edge. And so for us, that's been really a powerful, in Washington, a powerful statement to hear people saying, you know, your services are needed and they're important, rather than the sort of typical response to poverty programs as just, you know, a handout. That is a powerful message, and one I'm really hoping that we can leverage nationally to say we have to change the narrative around poverty and poverty mitigation programs.
This is Kathy in Colorado, and Babs, I completely agree. I was kind of going down a similar path, and Aaron, you really vocalized everything very well. It's a great time for us to think about the positive and reframing our programming, and also starting to think about where the gaps are in our current programming. I think it's been interesting for us to kind of see as we're going through this, like, gosh, we hadn't thought about this, and really is not something that we've addressed in our current, you know, technology. Our tools that are there for clients. So for me, you know, in addition to the things that both Aaron and Babs said, which I think are really important, is starting to do some analysis of how can we really beef up our programs and our technology so that if we encounter something like this in the future, and we know that this current crisis will probably continue on for some time, how can we continue to make our programs the most robust and accessible as possible? And it's really started us even thinking about gaps in who we serve. And so we've seen, you know, of course, we're focusing really heavily here on the TANF program, but we've seen a great need in Colorado of single individuals without children who are in crisis situation, and have found that even though some counties have local programs, you know, general assistance type programs available, that the majority of these individuals aren't getting assistance. And so how can we start to try to branch out our thinking and our funds into helping all aspects of our population, rather than just those that our programs currently assist?
This is Avis. I agree 100% with you ladies, especially Kathy, what you said. We've been kind of thinking about how we can assist individuals without children, you know, adults that maybe fall upon a hard time. They might be working, they might have need a car repair, need something like that, need some kind of supportive service to keep them employed. We've been kind of throwing the idea around for about a year now, about developing a general assistance program, not calling it that, but calling it something to where it's more of a work support type program. And I think this pandemic has definitely brought to the forefront the fact that, you know, there are, as you all say, a lot of people that are, you know, just one paycheck away, just 1 month's worth of pay away from you know, being in a crisis. And I think that this is an opportunity for us to see, you know, how can we better serve not just the clients that we serve, but how can we better serve all of our citizens of the state? You know, are there gaps in service? Are there things that we can do, things that we can provide that would be meaningful, not just, you know, starting a program to start a program, but providing a meaningful service, I think, is what we have an obligation to look at and to move forward with that. So, and I just have really enjoyed hearing from the three of you what has been going on in your state, and have heard some great ideas, and going to take those to my leadership and see if we can kind of use some of those ideas and expand on them.
Well, we have a few minutes left. I'm really appreciative of all the questions folks have been submitting along the way. I'm sorry we're not going to be able to get to all of them. There were a few that I wanted to sort of pose to the panel in the time we have left, and I'll try to sort of summarize them, but talking a little bit about the budget implications associated with the pandemic. So obviously this is going to be a big deal for state budgets, and sort of the flip side of that is the need is now greatest. And so there have been a few questions about sort of what does this mean for state budgets and within your agencies, and then the flip side, where are there opportunities, if any, to increase aid or supports for families, whether it's benefit amounts or supportive services?
So this is Babs, and I love that question, so I'm going to jump in. But that question is amazing because all the states are going to see a huge economic downturn. Some of the small businesses and other businesses won't survive this crisis, and then unemployment rates are going to go up. And this is the time when our services and our benefit programs are the most necessary. I think as well, though, the conversation about saying, see how responsive we've been to meeting people's needs, and those needs are going to continue, and cuts to these programs are not the place you want to go to fix budget deficits. I also want to just say that Congress has acted fairly swiftly to ensure that there is some level of funding to states to help them through the crisis. And I would hope that there's some opportunity as well to see economic recovery funds coming into states as well that could support helping states move out of this. The other thing that we're doing in Washington is trying to learn from the recession, the 2008, 2011 recession era, what not to do. So the cuts that were made to human services programs at that time, we've seen the devastating impact of those and have started to put those back. Let's not revert to the same old cross-the-board budget reduction exercises, but let's really pick and choose what's most necessary for economic recovery. And I think that's the tack we're taking in Washington. Definitely, we're going to have to streamline and we're going to see budget reductions. But I think that's the focus has to be on how do we help the state and the people living in the states get through this and then recover from it. And that means our programs are going to be important to that.
This is Kathy in Colorado. You know, of course, we are starting to already kind of see the implications of the possibilities of some budget cuts statewide, which will have some impact on our programs and our ability to fully utilize funding and all of those things. Mostly what we've seen is because we've enacted the disaster policies at the county levels, they're just seeing a real spike in not only applications for, you know, the basic cash assistance of TANF, but diversion payments to assist in the short term. And so they're spending pretty significantly and really tapping into their county reserves. And so we're starting to have some discussions here in Colorado around what does that look like? You know, what spending is happening? What are the spending needs going to be moving forward? Because we know this isn't going to just affect, of course, these few months here, that this will have an economic impact moving forward, and most likely we'll continue to see the need to assist our individuals and families beyond these few months that we've already seen. So how can we start to access our state long-term funds to assist counties to kind of have that best approach to and ability for them to access funds to support families as they need to when they're coming in. So we're starting some of those discussions, which of course are challenging at the same time as, you know, discussions are happening at a state level regarding the need to cut certain programs and funds.
So there's a couple minutes left. I don't know, Avis or Aaron, if you have anything to add.
I guess I would just, this is Erin, I guess I would just add that I hope that this is an opportunity for the federal government to look at TANF block grants and to consider maybe increasing them, considering they haven't been increased in decades. And we know that this, you know, we've already seen the increase in caseload, and we also know that TANF caseloads are directly correlate to the economy. And so when the economy is good and there are lots of jobs out there, we have fewer people who are on TANF and who need TANF. And the chances are that our economy is not going to be good. And who knows how long that's going to last, but we are going to have increased caseloads most likely. And so a level fund is essentially a cut. And so to be level funded for so many years and then to try to address the most critical needs of folks and expect them to get back to work when there are fewer jobs is just not realistic. And so, so I guess that's kind of my reflection on the budget question.
And this is Avis. Erin, I think you read my mind. I was thinking the exact same thing in terms of, you know, the block grants, how it's, you know, been at that level for so many years, and what is the dollar worth now. So I think you said it so well, I can't add anything else to that. But I will say this in Alabama, and we are having an issue trying to help fund, you know, child care has been an issue for us lately, especially with the pandemic and so many of our child care facilities, of course, closing because of, you know, social distancing, things like that. But as businesses open up, there is going to be a need for child care. And one thing that we're going to have to try to do is facilitate child care placements, you know, child care daycare placements, daycare homes, and things like that. And so that is one thing that we've been trying to look at with our TANF funding to see how we can help that process, because we're already hearing from clients that are anticipating going to work or that do still have jobs, that they're not finding places for childcare, safe childcare for their children. So that's a concern that I wanted to mention earlier, but that we are dealing with here in Alabama.
All right. Well, we're approaching the end of the webinar, and I really want to, I can't overstate how appreciative I am to the four panelists for what was a thoughtful conversation, and I think represented well some of the challenges that TANF programs at the state and county level are facing around the country, and where there are opportunities. We also really appreciate everyone who attended and submitted questions. I'm sorry we did not get to all of them. If you're curious about NAWRS and other upcoming events, including a panel next week on domestic violence, check out NAWRS.org or follow us on Twitter. We'll also try to get a recording of the webinar up on the NAWRS website in the coming days. And similarly, the NAWRS website and our Twitter feed are the best way to learn more about the organization and find ways to get engaged, volunteer, and learn about the work we do. So I want to thank again the four panelists and all of you for joining, and have a good afternoon.
Thank you very much for having us.
Thank you. It's been great.